Welcome to Module 4, and again, as a reminder, in Module 4 we're actually looking at Chapter 6. We're jumping a little bit out of order, and now looking at the medical complications, the effects of chronic alcohol consumption. Again, recognize that we last spoke about Chapter 4, which was addressing the effects of alcohol consumption, the acute effects of alcohol consumption, how alcohol affects everyone. We're now jumping a little bit further ahead and looking at how alcohol affects individuals who have been using it on a regular/chronic basis. Again, recognize that the PowerPoints and the narration that accompany them are not intended to replace the reading of the chapters in the book. They're really meant to try to highlight some of the things that are most important in the book. And so you see here that there's 4 main points that the author is trying to make in this section, and we're going to talk through all of these. What are the signs and symptoms? What do we see in people who have been consuming alcohol on a chronic, regular basis? And more systemically, how does that chronic alcohol consumption affect really almost every part of the body, the internal body systems? We will look at the effects of alcohol on sleep and memory. We're also going to look at the effects of alcohol on the developing fetus, fetal alcohol exposure, fetal alcohol syndrome. We'll do a little bit of work in the module kind of fleshing that out more so than what they address in the book. And we do want to take a look at the syndromes associated with alcohol withdrawal. The author does make the point that early on, there are really typically very few, if any, external or observable signs of alcohol dependence. We tend to see things more that are either behavioral in nature, non-physical in nature, mood, affect, etc. And so when we begin to see external visible signs of alcohol complications, they're typically an indication that the person has been using alcohol pretty regularly, pretty chronically, and oftentimes heavily before these symptoms begin to emerge. As we're going to look at in this chapter, that repeated chronic regular use of alcohol does cause problems across multiple body systems, and we're going to quickly walk through all those systems in the chapter. Over time, if a person continues to use on a regular basis, that chronic alcohol consumption is basically going to go from, quote, bad to worse. And so things get more and more complicated over time. Minor problems become more significant, become more major problems. Minor complications become more significant, become major complications. And so what you're going to see is that repeated use of and continued use of alcohol will lead to increased problems over time. And then a surprise to some folks is that if in fact a person begins to develop or experience secondary medical complications because of their alcohol consumption, again, those complications are going to be progressive. They worsen over time. At some point, most tend to become irreversible. The person can't go back to a pre-use stage, and many of them will also have fatal outcomes. As you can see here, chronic alcohol use really doesn't result in a pretty picture. From an external perspective, from the outside perspective, if we look at someone who's been drinking on a regular chronic basis, there's certainly some behavioral indications that are obvious. Depression, lethargy, withdrawal, isolation is something that might be obvious. There's hyper or extreme pigmentation, and really related to both dietary, nutritional impacts, and then also liver complications. The presence of jaundice, development of a jaundiced skin, a yellowish cast of the skin as the liver becomes more and more complicated, gradual overall weakening in appearance. Heavy perspiration is not uncommon, and also multiple bruises in some cases because the alcohol has impaired the person's balance, gait, etc. And so they are falling, they are involved in situations that can result in bruises and things like that they don't necessarily recall being involved with. Nutrition and alcohol, nutritional deficiencies and chronic alcohol consumption and neglect of basic everyday activities like brushing your teeth oftentimes results in poor dental health, and again, more related to nutrition or lack of nutrition when someone's drinking is the appearance of a variety of skin disorders, and we'll talk about those a little bit later in this chapter. Irritation of the throat, and so you sometimes will have a hoarse voice, Bad breath, halitosis can occur. We will see how various organs in the body will either become larger, and in particular, I'm going to again come back to enlargement of the liver, and then other organs that shrink in size. Fingernails and eyes can become discolored and brittle, in part related to liver problems and in part related to poor nutrition. So the outside picture, looking at a person who's drinking on a regular basis, is not a pretty picture to take a look at. We're going to start first by taking a look specifically at how alcohol affects the GI system or the gastrointestinal system. Again, alcohol has to enter. It's swallowed, passes down the throat, and as we talked in Chapter 4, passes into the stomach, and then from the stomach into the small intestine and into small intestine, large intestine, etc. And so alcohol is in fact an irritant, and so it will cause irritation on pretty much every organ that it comes in direct contact with. There was some reference to GERD or gastroesophageal reflux disease, kind of a reflux up the esophagus, contents passing out of the stomach into the esophagus, which is irritation. Esophagitis, jitis is a medical term, or itis is a medical term that really means inflammation. So esophagitis is inflammation of the esophagus. You'll hear itis, bronchitis, irritation of the bronchial tubes, those kinds of things. So itis almost always means an inflammation. You'll just follow that down below. An irritation of the pancreas or pancreatitis, and so inflammation of the pancreas. And then at some point, problems may develop in the gallbladder. Although, interestingly enough, moderate alcohol use actually reduces the presence of gallstones, and so not necessarily a problematic effect. We're going to talk a lot about the liver, and so when you think about the impact of alcohol on the body and on the gastrointestinal system, it would be hard to overstate the complications that occur because of the problems that it causes on the liver. The liver is responsible for the metabolization of alcohol. In order for alcohol to be broken down and to get out of the person's system, then it has to be acted upon by the liver. The challenge is that it's pretty demanding for the liver to do that, and so over time, chronic exposure, chronic consumption of alcohol leads to a variety of steps of more and more medical complications in the liver. The first stage is simply an accumulation of fat and what we would call a fatty liver. So the person's liver becomes larger, more swollen, more distended because there's fat that's accumulating in the liver. The next stage is going to be the development of alcoholic hepatitis, and again, itis means irritation, and so the liver now is in quote an irritated state. It's not functioning properly, so the uric is inflamed and hepatic, and then the final stage in the progression of liver complications is going to be the development of an alcoholic cirrhosis. It's important to recognize a couple things. There's symptoms down there because problems being developed in the liver. It's also not doing the things it should, and so the yellowing of the skin, jaundice, which can be visible in the eyes and visible on the skin, is one of the signs that there's a problem in the liver. Not all jaundice is in part because the person's developing liver problems from alcohol consumption, but jaundice can be an indication of liver problems. Those problems might be caused by alcohol consumption. A number of other things that are accompanied by liver complications would be, skin problems, i.e. itching, chronic itching of the skin, loss of energy or fatigue, not fewer but fever, weight loss. Ascites is the accumulation of fluids around the midsection, and so increasing ascites talks about how people's, not only is the liver swollen, but as fluids build up, then their stomach actually becomes swollen and distended because of fluids that are accumulating. You're going to have darker urine and lighter bowel movements or stools as the liver becomes more and more complicated. Before we move our attention to the effects of alcohol on the blood or the hematological system, a couple quick comments about liver disease, and pay special attention to this in the chapter. They talk about the role that bile plays, the accumulation of bile, which correlates with the development of jaundice. They also talk about the fact, though, that stage 1 and 2, the fatty liver and alcoholic hepatitis, can be reversible. And so if a person stops drinking, there is the likelihood that they could, in fact, reverse the harmful impact of alcohol on the liver. But they go on to say that alcoholic cirrhosis, or the third stage of liver disease, is not reversible. Once a person gets to the stage of being diagnosed with cirrhosis, at this point there's widespread permanent suppression of liver cells, and the liver becomes scarred. And so the cells that should be functioning have basically now been replaced with scar tissues, and that condition is not reversible. If a person continues to drink, about 1 in 10 long-term heavy drinkers eventually develops alcoholic cirrhosis, and once it's irreversible, you can't go back to your original unimpaired state. If a person continues to drink after they've been diagnosed with alcoholic cirrhosis, there's a significant percentage of them, over 50%, that will oftentimes be dead within 5 years. So read the description in the chapter to get a better handle on the progression of liver disease. It's the most obvious and the most potentially the most physically damaging effect of chronic alcohol consumption. As they describe the impact of alcohol, of chronic alcohol use, they talk first about the impact on the red blood cells, and the most common complication being that of anemia, where the person doesn't have as many red blood cells as, quote, a normal non-impaired person would. And they really talk about two reasons for this. One is that really just inadequate nutrition. The other is that there could be a chronic bleeding that occurs in the stomach in particular that could lead to anemia. And also the fact that red blood cells may be broken down more rapidly than normal by what they call accelerated hemolysis, or the breakdown of red blood cells. In people with chronic alcohol consumption, they talk about the fact that the average lifespan it can be reduced by up to 50%, and so our body isn't producing as many red blood cells as it should, and those red blood cells are being destroyed more quickly than usual, all of which will ultimately lead to impaired presence of red blood cells in our body. When the author talks about the impact of chronic alcohol use on other parts of the hematological system, then that references to kind of the defender systems, those parts of blood that are responsible to really help kind of fight off infections and keep people basically safe and healthy, which are both the white cells and the platelets involved with infection fighting and clotting. As you can see, continued chronic alcohol use reduces the presence of those substances in the blood that are necessary to fight these infections, and so the person is much more likely to come down with chronic, long-term, lingering health complications. They also reduce the presence of platelets in the system, which are involved with the clotting system. And so if you're cut, you need platelets to help seal the cut and to coagulate, and so that the person is not going to continue to experience bleeding. They also make reference to an unusual and fortunately a not common complication called disseminated intravascular coagulation, or DIC, which is an interesting phenomenon. Take a look at that discussion, because it really is kind of a yo-yo effect. Initially, the complication is that there is really a broad or a diffuse accelerated coagulation that's occurring throughout the whole body. And so it starts by having a lot of coagulation, and because of that coagulation occurring, that ultimately reduces the presence of the substances that are responsible for coagulation. So the rebound effect is that at this point there is no coagulation occurring because it's been depleted, and at that point the person is susceptible to potential excessive and uncontrolled bleeding, and ultimately obviously in death. So an unusual complication, kind of a rebound thing, but all alcohol induced as a result of chronic alcohol consumption. This slide really just is an extension on some degree of the information we just talked about with the hematological system. Obviously, chronic alcohol consumption also decreases the levels of antibodies in our system. Those substances that are there to fight infections, to fight disease, etc. And so if we have reduced levels of those antibodies, we're not able to respond as well and as healthy as we could to the presence of infectious substances. Ultimately, if we have a weakened immune system, we are obviously then more susceptible to infection, disease, etc. They do talk about the fact that alcohol consumption does also increase the development and production of tissues in the liver, fibrous tissues in the liver that ultimately complicate and impair the liver's ability to function, causing cirrhosis to develop or to progress. The good news is that some of these effects are in fact reversible if the person stops drinking and resumes a healthy diet. Again, the effect that's not reversible is cirrhosis. So once the person's been diagnosed with a cirrhotic liver, then they can and should stop drinking, but it will not reduce, will not repair the damage that's occurred in the liver. So a quick look at the effects of alcohol in the cardiovascular system, obviously focused primarily upon the impact of chronic alcohol consumption on the heart. Take a look at the discussion there. They do talk about how chronic alcohol consumption basically makes the heart less efficient at pumping appropriately, and so there's a variety of complications that occur, really very similar to chronic or congestive heart failure. And so a potentially serious condition, and there's a variety of sort of what I call complications or twists to that. They also talk about a complication that they refer to as beriberi heart disease. This is beriberi heart disease is interesting because it appears to be a secondary form of secondary heart failure, and it appears to be nutrition or diet related. In that they talk about how the fact that it occurs because an otherwise normal heart fails because it can't keep up with the unusually or abnormally high metabolic needs of the body. So induced by nutritional deficiencies. They talk there as well, and this is not at all uncommon, about the use of thiamine to treat this condition. Thiamine, or vitamin B1, is a nutritional supplement that is very, very commonly used in treating and responding to people who have chronic histories of long-term alcohol consumption, and indicated typically when a person has been diagnosed with the presence of beriberi heart disease. You'll see on here reference to a couple of unusual things, Brugada syndrome and holiday heart syndrome. Take a look at those. There is a correlation of heart or cardiovascular problems developing around, quote, holidays or following chronic heavy alcohol intake. And when you talk to physicians and they take a look at assessing someone's overall health, what they'll talk about is how alcohol, chronic alcohol use, or actually even any alcohol use, can raise the blood lipids, the level of blood lipids or blood fats, and ultimately, as folks typically know, so if you have too much fat in your blood, then it can result in clogged arteries or atherosclerosis. So an unusual or perhaps or unknown link between chronic alcohol consumption and increased arteriosclerosis. There is a quick overview of the impact of alcohol use on the genitourinary system, looking at the kidneys in particular. They do talk about the fact that the chronic use of alcohol reduces the presence of what's called an antidiuretic hormone, or ADH. This basically means that typically the kidneys are able to what I call recover or retain water. But if there's reduced levels of this hormone in the system, then water is not retained or recovered in the kidneys, and so it has to be flushed, and so people tend to urinate more frequently. They also talk about an inflammation in the prostate gland, or prostatitis, which is a challenge, and they describe some complications that occur in the kidneys as glomeruli, or the filtering vessels of the kidney, become impaired. Glomerular abnormalities, which result in ultimate problems with the kidneys performing their function, which is primarily a filtering function. So take a look at the problems associated with these in some detail in the chapter. The next two slides will talk a little bit about the effects of alcohol on the reproductive system, and ironically, sort of contrasting effects. It tends to be more of a quote feminization in males with chronic alcohol consumption, tends to be more a masculinization of females with chronic alcohol consumption. And quickly, this slide takes a look at, so how does chronic alcohol use impair males? Well, in particular, there's diminished libido or sex drive, occasional sterility, and then the testosterone, low production of testosterone, results in some problems that are a direct result of alcohol consumption, shrinking of the testicles. So over time, because testosterone is reduced and more estrogen is present, then the person, in some level, becomes more feminine in appearance. And you can contrast that with the impact on females here, which is really the opposite. And so in this case, what you see is that there's an increased testosterone levels for females, which is obviously typically associated with male secondary sexual characteristics. And so in this case, they're becoming, quote, more masculine, less feminine. There's some complications because menstrual cycles are affected, decreased fertility, skipped menstrual periods, and so interesting and in some cases contrasting effects for males and females as a result of chronic alcohol consumption. The chapter does kind of a nice job, but a brief job of talking about fetal alcohol syndrome and what is now called fetal alcohol spectrum disorders, really related to the exposure of the fetus to alcohol while the fetus is still in the womb. So maternal alcohol consumption while pregnant. And take a look at the videos in this module because it does a nice job summarizing the impacts of alcohol on the developing fetus. One of the videos will talk about the triad of syndromes or symptoms that are associated with fetal alcohol exposure. And there's both physical and cognitive and neurologic and behavioral impacts. And so in addition to reading the chapter, please take a look at the additional videos that are included in this module to get a better understanding of this. It's interesting because fetal alcohol syndrome is really the #1 preventable cause of birth defects, and so many people don't associate FIS with the birth defects that you're going to be seeing and hearing more about here. So take a look at not just the chapter, but also at the supplemental materials that are contained in this module to get a better understanding of the impact of fetal alcohol exposure. A quick summary of the effects of alcohol on the respiratory system, i.e. our breathing system. Interestingly enough, while alcohol is a central nervous system depressant, it does actually increase the rate of respiration because of the effects on the respiration center in the brain. So kind of a contrasting symptom with some of the other impacts of alcohol consumption. But it also interferes with defenses at a cellular level. And so once again, kind of going back to some of what we talked about earlier, person now has less able to fight off to protect him/herself as a result of their chronic alcohol consumption. It ultimately impairs respiratory function, and so breathing problems, emphysema, chronic obstructive pulmonary disease, inflammation of the bronchitis or bronchial tubes or bronchitis, asthma, lung cancers are all at increased incidence for people who have a history of chronic alcohol consumption. And again, kind of a combination of some of the things we talked about earlier. If you are exposed to airborne pathogens, tuberculosis, etc., then the person would have a diminished ability to fight off infections that are caused by airborne pathogens. The authors talk quickly about how alcohol impairs the endocrine system. The endocrine system is that system of our body that produces the hormones that we require to function, quote, normally. There clearly is an impact on the pituitary gland, which to some degree is considered sort of the primary gland in the endocrine system, but also there are other parts of the endocrine system that are what I call dependent upon quote information or instructions, as the author calls it, from the pituitary gland. So if the pituitary pituitary gland is not functioning properly, then the rest of the glands in the endocrine system are also going to be adversely impacted. Some of this has already been explored a little bit earlier when we talked about the reproductive system, i.e. testosterone and estrogen. So as you look at this section of the book, you'll see a repeat of some of the things that we've talked about earlier. Ultimately, if a person continues to do alcohol on a regular basis, because of the interference with this function, it again complicates the liver's ability to do its job, that whole progression from fatty liver to hepatic liver to cirrhotic liver. And as referred to in the discussion of the reproductive system, it's not just the male-female hormones, but it results in a variety of hormonal imbalances throughout the body. The body needs to be in balance to function normally. So anytime there's an impairment, then it's going to be there's going to be some adverse or negative impact as a result of the chronic alcohol consumption. A very high correlation between chronic alcohol consumption and increases of cancer really throughout the whole of our body, all of our body systems. And so, as you see here, alcohol causes a variety of cancers associated with a variety of cancers: skin, thyroid, laryngeal, oral, head and neck cancers, esophageal cancer, stomach cancers. The list is fairly lengthy, and there is some belief that the reason why alcohol causes or is associated with so many cancers is that it's responsible for, it's the acetaldehyde in alcohol that's responsible for the increases in the incidence of these cancers. So many folks don't associate alcohol consumption with increases in cancers, but as you have read and see here, it really is associated with a significant increase in cancers and a significant cause of cancers throughout our body. Chronic alcohol use does have an impact on the health and the appearance of the skin, in large part because of nutritional insufficiencies or deficiencies, especially deficiencies of vitamins B, C, and zinc, as noted here. And this goes back to our earlier thing that outward appearance of someone who's using alcohol on a chronic basis is not typically a pretty picture. So take a look at this section in the chapter. A couple of things that are commonly or chronically associated with alcohol use includes the flushing, especially the nose and the middle of the face, called rosacea. There's also the development of scar tissue, subcutaneous tissue on the nose, which is called rhinopyma or rum nose. People, if you're old enough to have heard of W.C. Fields, then people associate rhinopyma with W.C. Fields, and they do talk about another one called porphyria cutanea tarda, which is basically increased pigmentation of the skin that also is accompanied by both hair growth and chronic blistering in areas that are exposed to the sun. The authors talk about the fact that it appears that alcohol is a contributing factor to these. It isn't necessarily a causal factor. It may just be a complicating factor, but in general, because alcohol and chronic alcohol consumption oftentimes results in nutritional deficiencies, vitamins, nutrients, etc., there's a host of conditions that develop over time as a person continues to use alcohol on a chronic basis. The authors describe a correlation between heavy alcohol, chronic alcohol use, and a number of arthritis, 4 different types of arthritis, 3 of which are listed here. They also talk about correlation between heavy alcohol use and a weakening of the bones overall, or osteoporosis, which is oftentimes associated with, quote, old age, but is commonly found in people who are drinking on a regular or on a heavy basis. They also talk about a rare condition called aseptic necrosis, or bone death, which is especially associated with the death of the bone in the head of the femur. It's related to a cutoff of the blood supply to that bone, which ultimately results in the death of that bone. And so take a look at the complications of alcohol on the skeletal system. As you look in the chapter here, What we now get introduced to are a couple things that are important to note. Early on, I talked about how the liver is the organ that is probably most impacted by the presence of alcohol. What's more accurate is that the brain in the nervous system is the organ that is most dramatically impacted by the presence and the chronic use of alcohol. They introduce a couple terms here. Alcohol is in fact a central nervous system depressant, and so repeated exposure, repeated use of it causes the brain to adapt to become used to having it present over time. Once that begins to occur, the person progresses from use or experimentation to use to social use to problematic use to a substance use disorder. It's this adaptation over time that's the characteristic of that progression from non-problematic to problematic use. Part of how we know that's happening is also the presence of the alcohol abstinence syndrome, or what is more commonly called withdrawal. If the brain and the body has adapted to the presence of alcohol, in the absence of alcohol, then the person will begin to go into alcoholic withdrawal. And there's a cluster of things that accompany that. They talk about a relatively uncommon situation called alcohol idiosyncratic intoxication. Unusual, triggered by small amounts of alcohol, but the person who has this goes through some significant behavioral changes once he or she consumes alcohol. Four key terms that are introduced in this chapter are dependence, tolerance, craving, and withdrawal. We're going to discuss those continuing throughout the course. Dependence is defined really by the development of withdrawal symptoms should the person stop using his or her substance of choice. Withdrawal or dependence is symptom specific. Withdrawal is a term that's as closely associated with that. Withdrawal is also substance specific. So how you look when you're withdrawing from alcohol is very different from how you look if you're withdrawing from opiates. And so you're going to hear those terms again. Tolerance and craving basically are descriptors of changes that occur over time. If I become used to the presence of alcohol, I now begin to adapt to it, and it takes more alcohol to get the same effect. So by definition, I can now tolerate. My body's developed a tolerance to the presence of alcohol. I need to use more to get the same effect. Craving is the desire, the strong compulsion to continue to use. And so, again, characteristic of the presence of a substance use disorder, the person begins to crave the substance, is preoccupied with the presence, the use of it over time, things like that. We'll explore those throughout the course, and so I just want to highlight the introduction of them here. They also talk about a couple of specific organic conditions that can develop, Wernicke syndrome and Korsakoff psychosis. They describe these as a result of actually nutritional deficiencies, especially of vitamin B1 or thiamine, which again reinforces how over time you can see how chronic alcohol use, chronic alcohol consumption can impact us in ways that are unforeseen, and really that until you look at it, you don't quite understand how serious and how significant the impact is. So take a look at the descriptions of both of those complicated cognitive situations. Wernicke's is characterized by the person who appears confused, delirious, or apprehensive, and oftentimes accompanied by this rapid eye movement called nystagmus, which is a rapid lateral eye movement. It is problematic. It also is something that can be treated. Korsakoff psychosis is also problematic. It doesn't necessarily respond well to treatment. And in this case, the person is unable to distinguish between fantasy and reality. They talk about a term called confabulation, which the person presents as fact, which really has no basis in fact, although it is not an intentional lie on their part. So read the description of both Wernicke's and Korsakoff's. Become familiar with that as you read through that chapter. They continue to describe a couple of other things that are characteristic of some of the organic brain diseases, paralysis or inability to move the eye muscles. I talked earlier about nystagmus, which is this rapid lateral eye movement. In some cases, another complication is almost the opposite, which is that the person appears to have what's called gaze paralysis. They are unable to change their focus on something. We talked about Wernicke's up above. That's also accompanied by some gait difficulties, walking and balance. Confabulation we described in the previous slide. Talking without facts, but not recognizing that they're that it is not a fact, but a belief that that's really the truth. So it's not an intentional lie. It's simply the filling in of blanks and talking without the facts. Specific parts of the brain, we talked earlier about how different organs may shrink over time, and there is evidence that the brain does in fact shrink over time as a result of chronic alcohol consumption, and also that there's a disorganization. The brain, the cerebellum in particular, is a late complication of chronic alcohol use, but over time the person basically begins to lose the organization and the ability, the skills that are associated with that part of the brain. In particular, the cerebellum coordinates complex motor activities such as walking, and so you're going to see problems relative to that here. The authors describe the impacts of alcohol on the tissues, and in particular talk about the fact that chronic heavy use of alcohol damages the nerves and other tissues in the body. They make specific reference to the deadening of nerves or alcoholic polyneuropathy, neuro meaning nerves, pathy meaning deadening, poly meaning many. So over time there's a deadening of the nerves, and in particular oftentimes associated with the extremities, so hands and feet. You can't feel things, you can't sense things the way you normally would, and so it becomes hard, especially to do things like walk, because you don't get the cues back that you need to maintain balance and gait and things like that. Muscle damage can and does occur with chronic alcohol use. I think in the book they talked about it being pretty common that anywhere about 50%, 40 to 60% of chronic alcohol users will experience muscle damage. Sort of a next step in that is alcoholic myopathy. Again, myo meaning muscle, pathy meaning deadening. So in some cases, it will progress to the point that the person has lost muscles as a result of their chronic alcohol consumption. They talk about a vision problem that can emerge, which really appears to be related to the combination of alcohol and tobacco use, but a gradual blurring, loss of vision, and a pain behind the eyes, and then subdural hematomas, but basically a brain bleed that, if undetected, untreated, will ultimately increase pressure on the brain. It isn't just associated with alcohol consumption. Anytime there's brain bleeding, it's a problem, but there is a specific form of brain bleeding that is a result of associated with chronic alcohol use. In addition to what we have already discussed, the 6 items listed here are more commonly associated with people who are involved with chronic heavy use of alcohol, all at increased frequency for people who are in fact drinking on a regular basis, and all problematic for a variety of reasons. There are a number of miscellaneous effects that really don't necessarily fit into one of the systems that we talked about up above. These are all described in some detail on page 178 and 179. Unusual kinds of things, all with specific names. So be familiar with the fact that in addition to affecting specific organ systems, there are some conditions that affect multiple organs that again are associated with the chronic consumption of alcohol. Similarly, on page 179, they provide you with an overview of the 5 items that are listed here. Part of why I think this is important to acknowledge is that some of the impacts of alcohol, chronic alcohol use, may be more apparent, i.e. we know it's a central nervous system depressant, but we don't recognize is that there are metabolic conditions that are influenced by the chronic and heavy use of alcohol. We don't necessarily associate alcohol consumption with impairment of the metabolic system, and so take a look at the description on page 179 to get a better handle on these complications and their association back to chronic alcohol use. Chronic alcohol consumption does impact in a negative way, impair sleep, and in particular, we know that it reduces or depresses the rapid eye movement phase of sleep that appears to be really essential to sleep being something that's restful and restorative. And so if people aren't able to sleep as well, then they're not going to get the rest that they need. They're not going to enter that restorative phase of sleep in the way that they should. There is some sort of belief or hypothesis that DTs, which are symptoms of withdrawal, and the hallucination that may accompany alcohol withdrawal, are perhaps a result of the brain's need, the body's need to enter this REM or to experience this dream stage of sleep. Again, a hypothesis, meaning there's questions. It isn't necessarily agreed to yet, but there's some suggestion that perhaps that's why people who are in alcoholic withdrawal experience DTs and hallucinations during that phase. There is also an impairment. Many folks are familiar with obstructive sleep apnea, which can be caused by a lot of things, but there is an effect where alcohol consumption does associate with increased problems with sleep apnea during sleep, and also perhaps related to the problems entering the dream state is that chronic alcohol users will report and experience more nightmares, more problem dreams during their sleep stage. There is a nice discussion in the book about the relationship between chronic alcohol consumption and blackouts. It begins on page 183, and they do a nice job talking about some terms called blankouts, grayouts, blackouts, and kind of trying to distinguish that there's various sort of levels of the inability to retrieve or to recall memories. There's speculation that part of what happens is that alcohol does impair our ability to store, to process, to retrieve, to transition memories. There is evidence that the more heavy and more chronic the person who used alcohol, the greater the likelihood of alcohol impairment in memory. They talk about the fact that even the amnesia that does occur during a blackout isn't necessarily the same from person to person. About a third, roughly, of alcohol-dependent people don't experience blackouts at all, and then the other two-thirds will experience them, but some on a regular basis, some on an occasional basis, some very, 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 very sporadically, not on a regular basis. And when that amnesia occurs, even that isn't the same. For some folks, it's very quick, very rapid, sudden onset. It's complete, and they can not recall the information. They can't recall what occurred in that time period. For other folks, it just seems to be gradual onset. It doesn't necessarily occur suddenly. There's not really a specific definite onset. And the person, in some cases, is going to recall part of the information, may have the ability to recall more information when they've been drinking. So we do know there is an impairment in memory, but that impairment appears to differ from person to person. When they discuss the complications of alcohol withdrawal or withdrawal from alcohol and the alcohol abstinence syndrome, they talk about a variety of symptoms that are associated with and accompany this alcohol withdrawal syndrome. And they're sort of in gradual stages of complications. On a minimal level, the person becomes to be not depressed, but more agitated, more irritated, or what they call hyperarousal. Alcohol is a central nervous system depressant, but as the person begins to alcohol withdrawal, instead of being depressed, he tends to become the opposite, more agitated, more anxious, etc. And so this is usually the first stage of alcohol withdrawal. For some individuals, the person will progress to the point of experiencing what they call alcoholic hallucinosis or alcohol hallucinations. It only occurs in about 25% of those who do withdraw from alcohol, and it generally occurs pretty early in the process, usually within the first 24 hours. It does include true hallucinations, i.e. both auditory and visual hallucinations. It includes illusions. It's got a misinterpretation of things that are in fact present in the environment. The person experiencing these alcoholic hallucinosis, however, is not completely disoriented. They are oriented to person, place, and time, so they're oriented times 3. For some folks, they will progress or experience the third of the withdrawal syndromes, which are called convulsive seizures. Rum fits is an old term that I don't hear a lot anymore, but you may hear some folks still talk about them as, quote, rum fits. And these are basically, seizures that look very, very consistent with epileptic seizures. They describe in the chapter that they're usually generalized and they're large or grand mal seizures. The eyes roll back in the head, the body muscles contract, relax, extend rhythmically and violently, and there's a loss of consciousness. So They are problems. Basically, if a person enters into convulsive seizures, the goal is to keep him or her safe and to wait for the seizure to reach an end. And they usually last for a minute or two, after which the person will appear to be disoriented, groggy, etc. They describe that well in the book. So that's the third of four symptoms of alcoholic withdrawal. And then the final and most serious of the alcoholic withdrawal symptoms is known as the DTs, the delirium tremens. And one of the challenges is that in the past there was a pretty high mortality rate associated with the delirious tremens. That's been improved today with medical treatment, but there's still a relatively high 1 to 2% mortality rate for individuals who go into the DTs. And there's really two major, what I call parts or components of this withdrawal state. And the person may appear to have one more predominantly than the other. The delirium is the hallucinations, the confusion, the disorientation that is a part of this syndrome, and the tremens or the tremulousness are the agitated nervous body, nervous system actions that are evident to the external person. They become very tremulousness or tremors, agitated, elevated pulse, blood pressure, things like that. It's the opposite of the influence of alcohol. The body is no longer sedated. The body is now stimulated or agitated. And so you combine the two, if the person's experiencing both hallucinations, disorientation, things like that, as well as these autonomic nervous responses, it becomes an overwhelming challenge for the person to manage and for the medical team who's involved to try to get the person safely through that stage. The acute phases of DTs, as they describe in the chapter, can be significant. They can go from a day to a week, which is a long time. In most of the cases, it goes for about a day-ish or so. They talk about 25 hours. And then in 80% of the cases, it'll be resolved within about 3 days. So that leaves about 5% of the cases will go beyond the 3-day period. If you know people who work in a detox setting or an emergency room, what they will tell you is that withdrawal from alcohol is the most serious or life-threatening withdrawal. And so I really pay attention to the discussion of alcohol withdrawal and the alcohol withdrawal syndromes in this chapter. They do make reference to a late withdrawal phenomenon, and they also, you will hear it in other places referred to as post-acute withdrawal, and it really is used in a couple of different ways. In some cases, there's specific withdrawal symptoms, i.e. indications of the alcoholic abstinence syndrome or other medication abstinence syndrome, which reemerge after time when it appears that the person had reached a point of being stable. And so there may be physical symptoms. In other cases, they're talking more about personal experiences that are less acute than the physical symptoms, which are more cognitive kinds of challenges, memory disturbances, anxiety, mood, things like that. And so in this case, it isn't necessarily the emergence of the physical symptoms of withdrawal, it's more cognitive or other symptoms. So a little bit of a controversial topic, but it is something that's being talked about, so be familiar with that concept. So as we get ready to close this chapter, two things. Here is just a brief summary that withdrawal, not just from alcohol, but withdrawal from any substance is a very serious problem. And anytime a client enters into withdrawal or patient enters withdrawal, then it's important to make sure that he or she has the medical supervision, the medical supports, the medical staff necessary to make sure that they can be adequately and carefully monitored until they've safely gone through the withdrawal process. And the primary focus then is that the person has to be kept physically safe. And so we don't really talk about the higher levels of treatment, i.e., motivation and acceptance of a problem. At this point, if somebody's in withdrawal, The primary focus is making sure that he or she is safe, that he or she is able to be safely withdrawn, and there has to be a reassurance, really the creation of a safe environment, reassurance and support to the individual that he or she will be okay, that people are there to help make sure they're okay, and that they can safely make it through this process. But it's really a basic keep the person safe, keep the person in a sheltered environment, monitor regularly until they get through that process. So that concludes the PowerPoint on Chapter 6. A lot here, a lot of concepts that we will revisit later in the course. So I encourage you, now that you've seen this, to go back and reread parts of the chapter that you still feel like you need to make more sense of. Please feel free to use the discussion boards to reach out to me if necessary. The goal here was to ensure that you recognize that there are some chronic effects of alcohol consumption that we only see when the person is progressing from experimentation to use to social use to problematic use to substance use disorder. Not everybody will experience the effects of chronic alcohol consumption, but if somebody is using alcohol on a chronic and a regular basis, then he or she is at greater risk of experiencing any or all of these complications, all of which require knowledge and support and interventions to help make sure that we can stabilize the person medically in order to help them restore themselves to a healthy sense of functioning. So thanks for listening to this presentation. Go back and reread the book, and I look forward to continued learning.